So yeah, we are faced with very strange situation. Uh, I think it'll be safe to say that none of us have experienced anything like this in our lifetimes, at least. That is a pandemic of this nature, and then we are forced to work from home, teach, attend classes, etc. So things like field work, which are essential for any student, and more so geography students, uh, be it physical geography or social geography. I believe there is no learnings and no way of understanding what we read, what we study, what we analyze, unless you go into the field. Reality is out there. We are removed from reality, and we are trying to understand it. So field research, field-based surveys uh, is essential for any academic endeavor to bear fruit. And now that we are stuck at home, what do we do? So I thought I'll share with you some of the experiences and insights which I have gathered along with my friends and colleagues who we tried to who with whom we have tried to do some surveys. Okay, so as researchers, we know that without new data, we cannot add to existing knowledge or add to the state of art. And so that's why we used either the latest data sets that are available to us or data sets that have not been used. Sometimes you have administrative data and other data sets which are being collected, and people don't know whether they exist. And then you find, oh, there is data, and those can be used. Now that digitization is happening, data is being collected, one finds that there are data sets which were not accessible earlier, or we use existing data in a different manner, uh, which is what all of us do. We use secondary data again and again, but we have our own perspective, have our own way of looking at it, cutting it, analyzing it. So these are the three ways, I think, in which we use data to say something new or say something differently, if not new, and bring new knowledge, new perspective uh, uh, to the existing state of art. And therefore we heavily depend and rely on secondary data. And as you know, these data sets which we depend on, India being a large country, UP being the sixth largest, if you look at UP size, it is the sixth largest country in the world, if it was a country. Most dynamics of UP, demographics and dynamics of UP decide world dynamics now, be it hunger, be it poverty, be it anything. So unless India wants to improve its statistics, UP has to improve its statistics. So collecting data for these large areas, large regions, therefore falls on the state and the government. And since the inception of the statistical commissions, the Central Statistical Office, we have been collecting data, and there are lots of data sets like the Census of India every 10 years, then the National Sample Survey data, which I'm sure Professor Sinha has talked to you all about, which includes the Employment Survey and the Consumption Expenditure Survey. Then you have the National Family Health Survey, which is the latest round is out for, I think, 2017-18. So it's a very contemporary data set, which everyone is using. And you have surveys of industry, agriculture survey, you have the socioeconomic caste census, a bit of which is available, not a lot of it is available. So there are these, and official administrative data, which is collected and sometimes accessible, sometimes not accessible. So these are all secondary data sets we rely on. And there are private organizations, institutions, which also do large data collection or large sample surveys. For instance, the India Human Development Survey, jointly organized by the National Council of Applied Economic Center at Delhi, and the University of Maryland in USA. You have ILO, you have World Bank, you have lots of international organizations which are non-governmental which collect data. So we have a large plethora of sources from which we can access secondary data and do our analysis. But sometimes we, or rather I would say, at least in our center, we emphasize that all our students collect primary data. Because secondary data sometimes is outdated, is not available, it does not have all the information, all the variables of interest, which we want to analyze, which we want to use to explain a phenomena or try to explain a concern which we have. And so secondary data sometimes is not available. For instance, the National Sample Surveys quinquennial consumption expenditure survey, which was last conducted in 2011-12, has not been conducted as yet, and it should have come out in I think 16-17. It hasn't come out, and we are poorer for that because we have no idea about the consumption expenditures of people across the country, which obviously have been very hit hard with the downturn of the economy, rising unemployment, and the job loss, income loss due to the pandemic lockdowns. So we really don't have an idea about that aspect of people's lives. In addition, some surveys are held only periodically, so which means that the migration survey, which is a special survey done by NSS, is done every 7 years or 10 years or maybe sometimes shorter. So there may not be contemporary data available if that is something which you're looking for your research project, your thesis writing, etc. And many times the data sets which we have, which are nationally collected or at state level, do not always contain all the information that we might, as researchers, hope to have under in one data set. And some variables are missing, which we want to then collect. There are new data sets like the India Human Development Survey, which have tried to bridge this gap by collecting information on a slew of all kinds of variables, be it income, which is done for the first time at a national level. It has income from 57 source of income at household level, consumption expenditure, wealth, asset, education, health, and so on and so forth. But it's also outdated now. The last one was done in 11-12, and the current round needs to go into the field, but it has been getting delayed because of the pandemic. So the large data set, large survey, which we are all waiting for, is not happening. In these situations, we will have to end up in some form or the other, try to collect our own data set in one form or the other. So there are many forms of collecting primary data set. The most common is a face-to-face survey, which is also called abbreviated as PAPI, which is paper-assisted personal interviews, or nowadays, as it is becoming popular, called CAPI, because you're using handheld smartphones or tablets or even laptops to collect information. So it's called a computer-assisted personal interview called CAPI. And these are face-to-face interviews where you go to your respondents, sit with them, chat with them. You have and in most cases, you have a structured schedule of questions, which is called a survey schedule, or a tool or questionnaire, as it is called. And you've pre-decided number of sections, and within each section you have questions, and those questions are asked as it is to the respondent, and those questions are repeated across respondents. So it's a structured, pre-decided questionnaire. Or you can do something of an ethnographic kind of an interview where you have the respondents speak and narrate their experiences over a period of time and the processes they have gone through vis-a-vis particular issue of concern. It could be migration, it could be accessing healthcare. It could be the different income sources they have tried to engage with over a past year, etc. And they speak a long narrative which is recorded, and then it's more qualitative in that nature. And nowadays, we keep receiving electronic emails with links to websites like SurveyMonkey, where you go and you take a survey, and this is becoming a popular method with students also, and other people who want to do a quick, purposive kind of a survey. So these are some of the ways in which primary data is collected, and I'm going to talk about now get into the aspect of telephonic surveys. So why are telephonic surveys important? So I'll tell you, during the first set of lockdown, which started last year in March, within a year, about 21 telephonic surveys were done in India itself, because there was no other way. And I know of groups who had gone into the field, started a survey, completed 2 entire states and in-depth surveys. And when the lockdown came, they made a shift to telephonic survey because they had already collected information about the household and also had contact details of the people. So in a lockdown or in a pandemic situation, it seems that telephonic surveys are something which are a good option. Your respondents may not be comfortable sitting with you face to face. Even if they are, they may not be comfortable giving you enough time because of the fear of infection or exposure. They may not be comfortable. So many people may even refuse. So the refusal rates might be very high, as people are afraid to interact with other people during a pandemic because of the fear of infection, but also because they are busy and struggling with ill health, family members falling ill, loss of income, trying to access food and healthcare, all the kind of problems we saw, which existed much more during the first phase. And during the second phase also, it was pretty bad for the first 3-4 weeks. So people are just not available. There's a lockdown, you can't travel. People are available at their home if they have managed to, if they have a steady source of income, they have access to food or healthcare, they're more or less available at home. And people who come from the lower income categories, who are daily wages and workers who need to work, they're traveling. So it's not easy to find people of a particular occupation or class type in a face-to-face survey. So how do you? What are the ways in which one can reach people through telephonic surveys? And the 3 I could think of right now was, one is the simplest, which is called the Snowball sampling method, where suppose you want to reach out to people from a particular region, say Haryana or Maharashtra or Bihar, and you find a person or a few persons, and you call them up, you ask them a few questions, and they then refer you to other people, their relatives, friends from the same region, and from one person to another and another, and so you just go on like that and keep calling people till your sample, you have enough people you think you have responded, who have responded to you. The other way is purposive sampling, where you know who you want to interview. It could be, say, a faculty, so you get a list of faculty members and their phone numbers. It could be frontline safai karamcharis or cleaning workers in pandemic, and you get a list of them from the NGO with whom they work. For instance, in my university, the workers who clean or collect garbage during COVID times, they are contractual now. Earlier they were non-contractual and worked with the university, so we had their contacts. and one could get their phone numbers from there, or now one has to contact the company which hires them, etc. So then you have a purposive group of people you want to approach. And if it's a large enough sample, if there are hundreds and thousands of people, then within that you can do a random sampling or whatever if you want that. And the third and the last, which is the most difficult, is to have a completely pure random sample, and which is what I'm going to talk about in a while, how we did it. And there could be other strategies which people, researchers, students could employ, because it's not easy to do a completely random sample at, say, at a national level or at a state level. So we'll look at that. In 2015, I think, I and a researcher friend of mine, Diane Coffey, we had an idea about certain aspects of perception, and we wanted to do a survey, and we thought, why not do a telephonic survey? And this is pre-pandemic time, so our motivation was not the pandemic, but basically saving time and money, because we had little money, and Diane got some money from the national, from NHS, National Health Service, is it, from in America, to do this telephonic survey. So Diane, who is a demographer, she and her partner, they founded the an institute called the Research in Compassionate Economics, and through the ages of that and me at CSRD, we did this survey. Diane is at University of Austin, Texas. She teaches demography there. So we came up with this idea to do a perceptions survey in India, and Dean came up with this acronym called SARI, Social Attitudes Research for India. He's very good with acronyms. They've also done a very good survey on open defecation in India, which, if anyone of you are interested, it has also come out as a book, which is called Where India Goes, and they called the survey SQUAT, Sanitation, Quality, Utilization, and Trends. So you can look that up. So basically, we did this telephonic survey in Rajasthan, Bihar, Jharkhand, Maharashtra, Uttar Pradesh, these states, and then the two cities, metro cities of Delhi and Mumbai, between 2016 and 18. So over a period of 2 years, we managed to do a telephonic survey of all these regions. It is a perception survey which investigates what people in cities, towns, and villages think about caste, religion, gender, reservation, intergroup marriages, open defecation, climate change, and a whole lot of other things. It's a very interesting data set. The data is free to be downloaded if anyone of you wants to work on these regions. After that, our funding kind of dried out, so we could not continue this, but we hope to do this later. Now, this survey is representative at the state level and city level, which means that its sample size is large enough for us to make claims that whatever findings we have are represent the entire population of that state or that city. So it's a large enough sample. It's not a very large, it's the just enough sample. We collected just enough sample for it to be representative. We don't need to do more than that. And it's a random sample of individuals aged between 18 to 65 years of age. So I'll now proceed to explain how we went about doing this telephonic survey. Do bear in mind that this was a funded project, so we had resources. So I'm going to explain, if you have funding, how can you do this a little bit. And then I'm going to move on to explain how I did it with my students during the last lockdown. So both things I'll talk about. And then if you have questions, we can take them. So what does SARI do? it has a sampling frame which is based on the following things, and I'll take each one of them separately. First is we use mobile phone subscriptions. We use random digit dialing. We do within household sample selection, and we use statistical weights from Census of India to build representative samples for adult population between 18 to 65 years of age. So I'll explain each one of them now. When we say mobile phone subscription, what do we mean? So let me give you an example. Let's take an example of Delhi. Now, we have this Telephone Regulatory Authority of India, TRAI. You must have heard of it. It's been under a lot of controversy with the, selling of the whatever for, and all the, corruption, etc. charges. So TRAI, what it does is, suppose we have Delhi, it will divide Delhi into cells, network cells. So suppose Delhi has 7 cells. Now within each cell of Delhi, there'll be service providers who provide you network services, such as Airtel, Vodafone, Jio, Dolphin, MTNL, etc. Now what TRAI does is gives a 5-digit number code to each service provider for each of the 7 cells. So if Airtel is present in all the 7 cells, Airtel will get a 5-digit code for each of the 7 cells, which is different in each cells. So will Vodafone, so will Dolphin, so will. So each service provider gets a unique 5-digit code in each of the cell. And these are the first 5 digits of the cell phone number which you and I, all of us, have for a particular service provider. And this is available from TRAI. TRAI gives this list out at state level, which we accessed. So we had the first 5 digits of the phone number from the Telephone Regulatory Authority of India, say for Delhi, in all of the cells. Then what we do is we add 5 more digits to these existing digits, but these 5 digits that we add are randomly generated. We use a random number generator, and these are random numbers. So we add 5 digits to the existing 5-digit code, and it becomes a 10-digit phone number. However, we do not know that this is an existing actual number which has been created by a service provider company or not. So that in that sense, it's a random number. And we create lists and lists of these random numbers. That is how the randomization of the sample comes in. So sometimes when you call a number, it says the number does not exist, it is not in use anymore, it is unavailable, unreachable, not answering, or it rings, and then finally someone picks up. So for every 1 number a person picks, there are 10 numbers which are basically either non-existent, not in use, or unreachable, or something or the other. So it's a time-consuming process, and it requires a system which I'll talk to you about in terms of how to. So suppose if you have to say survey Delhi, then for each cell of Delhi, for each service provider, we know the total number of numbers for each service provider. So we create randomly generate numbers in that proportion for each service provider in each cell. One has 10, so we'll say 100. One has 20, we say 200. So we create numbers in that proportion. We have lists, then we create these lists of numbers and we call them. Now, when our surveyors are calling them, we have Excel lists for each state. There has to be a system we developed, which means that if a number doesn't exist, then we give it a code, non-existent. If a number is unreachable, there's a code. If a number is ringing but not answering, there's a code. And if person picks up and says, oh, I'm busy right now, call me on Sunday at 5 o'clock, then we write down and remember to call that number at Sunday 5 o'clock. Or numbers which ring, we do not pick up, or unreachable are actual numbers which are unreachable. So there is a coding system, and you have to keep going back again and again to these numbers to try and see if that's an actual a person will pick up and respond to us. So for every interview we do end up having, we found that we have to at least call thrice before the person agrees to talk to us. Now, the next thing is within household sample selection. We know that cell phone coverage has increased tremendously from 17% to almost now must be 95% cell phone ownership exists in India at household level. So one would imagine everyone has a cell phone. But on an average, you find that unlike cities where father, mother, children, each one has a cell phone, on an average, we find there are 1, 2, or 3 cell phones at a household level. And mostly these are owned by the male household members who are earners. So if you're going to call up people and do surveys, you're going to end up with a selection bias because most of your respondents would be male earners or heads of the household. So your sample is going to be biased and you're going to find more and more of men within a particular age group. And also over a particular range of class, because some people may not be able to afford a cell phone. So those people who don't have a cell phone will anyways not be part of our survey, and that amount of bias will exist, which is the lower end of the income tail. The income distribution and the lowest quintiles you may miss out because those people are poor and they cannot even afford a small phone maybe. So in order to avoid this bias towards males, the system we had was when we reached a person, we asked the person about all the family members in his or her family, and we entered that while the person is telling us into a software called Qualtrics, and I'll tell you about Qualtrics in a bit. And once the list of individuals has been created, we will ask Qualtrics to randomly pick one person from that household list. And once that person is picked up, we'll ask the caller who has picked up the phone that could you please allow us to talk to that particular person. So that way we had built-in in-house randomization to reduce this bias, which is due to ownership of cell phone by male, usually male members of households. Then coming to weights. So in order to make our sample representative at the state level and the city level, what we did was we use the census data. For example, if you're doing UP, we take data from the census for UP, and then we bifurcate it by first cut it by rural urban population, number of people in rural areas, number of people in urban areas, within rural urban areas by male and female, within male and female so if you see this chart down here, you can see this is the different cells we create. So in UP, we have rural and urban. Within rural and urban, we have males and females separately. Now within, say, for instance, within rural male, we create 5 education categories for males. And mind you, our sample is between 18 years to 65 year of age. So any male, say, in rural areas would be falling in any of these 5 education categories, which is having had no schooling done, studied till primary, secondary, middle, or senior secondary. And any of these males could then fall in any of these 10 age categories which we created. The first one is 18 to 19 years of age, and the next till 65 are 5-year age categories. So each cell, as you can see, has a number in it of people for UP. Now, the proportion or the ratio in which this exists, we then keep on sampling making phone calls till our sample also has people in these cells in the same proportion as the real population. And the minimum number of people that is required to be representative of the actual population is calculated using power measurements. And then we create a sample, which is basically a ratio. You multiply the sample with the ratio, which I just explained to you how we got of male and female, rural and urban, and so on and so forth. And you generate the sample, which is representative at the state level. And there is a technical paper which explains the entire methodology of the survey. It's by Diane. So it's Coffee 2017, I think, and I can share a link later on, and you can have a look at it. So then the sampling is done like this. So you keep calling. So suppose you're calling, and midway you find that we are getting more male respondents with primary and secondary level of education between, say, 30 to 45. Then you refuse when Qualtrics randomly selects a person and it falls in the same category as I mentioned. Then you refuse to take the survey, or you say you call back, and you keep doing it till your cells, say female, urban, senior secondary, 40 to 45 age, that minimum sample is. So it takes time, but you have the option of changing midway and picking up your sample, which is difficult in a face-to-face survey. That's why in a face-to-face survey you need listings already and large sample. Here you can I won't use the word manipulate, but focus on finding more of those kind of people which are not being interviewed or being contacted in the initial part of the survey. And then as you progress, you can then keep trying to find those demographic and fill in your sample minimum requirements. Okay, now how do you operationalize a survey like this? And I'm just gonna, go over it in a broader sense. And if you have detailed questions, you can ask me. So obviously, we do a survey because we have certain questions in our mind. And we have broad themes, so we created those broad themes, and within those broad themes, we create detailed questions, and we don't know which questions are good questions to ask. And remember, this is a perceptions survey, what people think. So it's very important, and it's critical how you ask the question. The same question can be asked in many different forms. It can be asked directly, it can be asked indirectly. So we tried to do a lot of pre-testing, which means we created the questions, we discussed in the group that suppose we want to ask about women empowerment or intra-household decision-making, what kind of questions do we want to ask? And then amongst the pool of questions, we would then do our own pre-testing. We would just call up people randomly, create a number, and do a survey and ask these questions and see how people respond. So for the same information to be sought, we had 2-3 questions. And the question which we thought elicited a very good response or was easy to understand and as was not controversial and people were not uncomfortable asking it, those were the questions that finally went into the survey. So pre-testing is essential, because we don't know, we are sitting here and thinking something to ask, but when you go into the field, those questions may not work. And this used to happen that the questions which worked in Delhi, which is a metro, would not work in Jharkhand. We just didn't get responses. People refused to answer the question or didn't know what to answer. So we had to change the question midway as well. So the same question which works in particular regions may not work in other regions based on their culture, social, and other perceptions about that practice or that thing you are asking questions about. So when we had to constantly pre-test, constantly try different questions. And once the questions were done, we had to hire people to ask those questions. So we hired about 15 to 20 graduates who are either studying or have stopped studying. We trained them. We gave them a room with tables, laptops, cell phones, and trained them to ask a set of questions for roughly about 10 to 15 minutes. Because on a telephonic survey, you cannot have long hour, half an hour, 45 minutes kind of face-to-face surveys. People pick up the phone while they have a small gap or they're doing something, so the patience levels are low, and so 10 to 15 minutes was the maximum we had. So that training was done of surveyors, and they would work in 2 shifts, before lunch and after lunch. But most of the surveys which happened were after taking time, not once, not twice, but thrice, because most people either refuse or they don't want to refuse you, but say, okay, call me on Sunday. And when you call them on Sunday, they say, oh, call me in the evening. And then you call them in the evening, and they then finally realize, oh, these guys are serious. I'll have to answer their questions, or I refuse. So you have to keep going back, and that's how it works. Now, one of the things we use to create the questionnaire, to enter the answers from the questionnaire, was a software called Qualtrics. It is widely used in the West, and we had taken a subscription of this software. So the software allows you to create questions in it. It allows you to create spaces to type in the answer, or create drop-down menus, Likert scale, whatever have you. All the options are there. It is a brilliant software because it allows you to do randomization, as I mentioned, within households. So once we ask a respondent who we have reached that please share the list of members of your household, and we key it in, we say father, mother, or just XYZ, whatever, father, mother, son, and then Qualtrics does the internal randomization and picks one, and we can then ask the respondent to let us interview that person. You can do half and half. You can ask one question to half the respondents and another to the other half. You can change the sequence of the question. Suppose you ask a caste question, which is controversial, and then that kind of makes the respondent alert, or want them makes them give politically correct answers. And next time you want to ask a religion question or a gender question, so you can change the sequence of the questions. You can try different things. You can ask caste, religion, gender, caste, or gender, caste, religion, and Qualtrics will randomize them and give it to one third of the sample at randomly, and you can do a whole lot of other things. So it's a brilliant software. And what it does is, once you've entered the data, it will then generate data files, which is in Excel. So you enter the data in Qualtrics on a laptop, clicking answers or keying in some answers, which we try not to keep keying in answers, but mostly are drop-down menus, so it's faster. And then it generates a data file in an Excel format. So that is what Qualtrics does. And then we had to monitor the interview calls. There are people who are difficult sometimes. Interviewers sometimes spend too much time, or I did some pre-testing in Maharashtra, and I could get a person in a village speaking a particular dialect to a educated person, and I'll have to modulate my way of asking the question from sophisticated, simple to very simple, or even in their dialect. I come from Maharashtra, so I can speak in Marathi, Hindi, English. So it's sometimes it's very tricky, because it was on the phone. You don't know who's going to pick your call. It could be a farmer, very poor farmer. It could be a factory worker. It could be a bureaucrat. It could be a businessman, and you have to then accordingly modulate your, way of asking the questions. So it takes some learning. Now, this was a survey which was done as a part of a project. So we had the funding, we could hire rooms and create them as call centers. We could hire graduates as our interviewers, and we had people helping us out. But suppose as students and researchers, we want to do it at a small scale, it is difficult to do a representative and random sample selection, the kind I explained, at a small level. At a small level, a purposive or a stratified random sampling might be more easy to operationalize. Purposive, as I explained, is that you know who you want to interview. They could be faculty, they could be your student friends, they could be a group of people like frontline workers, doctors, etc. And you pick up a small sample. And within that, you randomize. So if you have 100 phone numbers, you randomly pick 50. Or you have 200 phone numbers or 500 phone numbers, you randomly pick up 100. So that would be purposive stratified random sampling. We have a habit of creating a questionnaire and then asking questions and then answering them in the questionnaire and then transferring data. I think it will, on a telephonic, when you have a headset and you're talking to a person, it's easier to, I would suggest to enter data directly into Excel sheets, where each row represents a phone call or a person you've interviewed, and the columns are the questions you're repeatedly asking. So at one go, you have a data sheet created rather than filling a printed out questionnaire while talking and then translating again in Excel. So I think that will save time. We did a COVID survey. I was sitting home and getting bored. So I thought, why not do a survey with my students? So 3 of my CSRD students, Tawheed Afzal, Arzu and Akshita, with their help, I did this survey. So this was during the first wave of the pandemic, after the second lockdown. And we got my SARI team. We have Payal, who is University of Berkeley doing a PhD now. At that time, she was working on the SARI project with the RICE team. So she generated these numbers for Delhi and Bihar, about 300 phone numbers, as I mentioned, randomly. And my 3 students then sat down, used their phone, and started calling these numbers. And for every 10 calls, they would manage 1 interview. And finally, we had it was a pilot survey. And we were hoping that if we get good results, we'll expand it, but we couldn't. But we had enough qualitative data because, so we ended up doing about 30 surveys in Delhi and about 30 in Bihar. And since it was a lockdown and people were home and they were struggling and quite frustrated, frankly, they were happy to talk and they wanted to really share at length. So we have interviews going on for 40 minutes and 1 hour. Though we had a structured questionnaire, we had 3 sections and a particular number of questions. We would ask a question, but they would take their time explaining everything. So it was good. So these survey results are now published as a part of a report, which has about other 21 telephonic surveys. And the report is called the State of Working India Report 2021, 1 year of COVID-19. It is taken out, the State of India report is taken out by Azim Premji University annually. So our small telephonic survey is part of that. And I'll share a link if it is available online for free for you to have a look. So I think I'm running out of time. I want to keep some time for question and answers. So I'll quickly go through this. So in the telephonic survey, first we created 3 sections. We wanted to ask people what problems did they have during the pandemic in accessing incomes, accessing food, and accessing health facilities. Once we had these sections, we decided about 5 to 7 questions only, 5 questions, anywhere between 15 to 20 questions, not more than that, in the survey, because we were hoping to be able to speak minimum for 10 to 15 minutes. So that's why we kept it very short. So as I already mentioned, we generated about 300 numbers for Delhi and Bihar. On an average, for every successful interview, 10 other numbers were either non-reachable or inaccessible or rejections, so it took some time. Since it was a lockdown, the length of, as I mentioned, the length of interview was longer. And I think because of that, the surveyors, my students, took notes. They had a questionnaire, and when people responded to a question, they wrote it down, but it ended up being a qualitative discussion. So they took extensive notes by hand, or they recorded the interview. I don't know. I will have to ask them. I don't think they recorded it. But once they heard a person speak for 20 minutes from memory, they jotted down, because you'll forget. In case you want to record the question, please, you'll have to seek permission of the person. You may not want to ask their name. You may not want to ask their location. You may not want to ask their address. So it's completely anonymized. So they are more comfortable knowing that their identity is not revealed to us. Then it is easier for us to ask controversial questions, difficult questions, politically incorrect questions, which they know that no one will know it's them who have answered it. So telephonic surveys allows you to do that, which a face-to-face survey will not allow, because you're at their home, you know where they are, they see you as an educated urban person. So if you ask a controversial question like, do you practice untouchability, which we have asked, they will give you a politically correct answer. But on the phone, they will not. So for instance, when a question was asked, does any family member practice untouchability, in a face-to-face survey in 2011-12, 30% of Indians, which is the ISDS survey, said yes, they practice untouchability. So obviously, many of them were refusing to answer the question or responding in a politically correct manner, which is called social desirability bias. But when we ask the same question verbatim in a telephonic interview, that in UP, this percentage was 62% of rural people in UP said they practice untouchability, and 40% of people in this survey, which I mentioned to you, 40% of people in Delhi said they practice untouchability of one form or another. So the anonymized characteristic of a telephonic survey helps a lot in people being honest and giving straight answers. So the results broadly from this telephonic survey, which we did during COVID, people explained to us that they had so many hardships, which are all in the report. You can have a look in access to income, food, healthcare. But the thing which we found out was that people from the marginalized communities and groups like the Dalits and Muslims and even tribals faced additional hardships, because when the first lockdown happened, suddenly the stocks of food, medicine, groceries, what have you, was limited in shops. Supply lines were cut off, and the stocks ran out very quickly, even money to lend. So when there's little to give, you can't even sell it, you have to lend it to people. Like groceries or medicine, you're lending to customers on credit. Then the shopkeepers or the pharmacists or the money lenders who are lending all this have to choose, because they have limited stock. So they chose to lend it to people from their own community at the cost of Muslims or Dalits. So this is, I think, something we found which none of the other telephonic surveys were focusing on or trying to find out. So this was something from I just thought I'll mention. Disadvantages of a telephonic survey: you don't get too much time. It's a telephone call, so people are impatient. Unlike a face-to-face survey where you have a lot more time. Number of questions you ask is smaller. You can't have detailed questions like we did for 45 minutes. 35 pages questionnaire in a face-to-face survey. In the ISDS survey, we can't do that. In-depth probing might be difficult, generally in normal times, but in COVID times, because people are stuck at home and they have issues and they are also frustrated a bit because of this. They want to share their grievances, they want to share their frustrations, so the interviews end up being long, etc. Advantages, as I mentioned, that the social desirability bias is less because of the anonymity which is inherent in this kind of surveys, and people want to talk to you. Okay, thank you very much. Any questions? I'll be happy to answer.